Well, to help us discuss issues concerning women generally, not just in the health sector, is Dr. Osasuyi Dirisu, Executive Director, Policy Innovation Center. Thank you for joining us.
Thank you so
It's
much.
good to see you.
Yes.
And thank you. Happy International Women's Day.
Happy International Women's Day to
And
you
all
too
those.
and all the women in your life.
Thank you. I have very fantastic people in my life. But what would you say, in your experience, is the most visible challenge, or some would say, that the women get to face, especially in the health sector and generally?
The challenges are enormous, and sometimes it looks like we continue to talk about these things again. But I always say that advocacy has to continue if we want to see change. But I mean, some of those things, first of all, those barriers that limit women's ability to navigate the system. First of all, we have just even lack of understanding. A lot of women sometimes, especially when you think about, from an intersectional lens, women in rural areas, women who are not educated, even women who are privileged. I mean, we find out that sometimes women just don't know what their rights are. Now, even when they know what their rights, they don't have the agency or the confidence to actually be empowered to make decisions for themselves. We see that decision-making power is something that is sometimes driven by financial autonomy. And sometimes you find out that financial autonomy, women also don't have. So sometimes we sit and blame a woman for not living an abusive situation. But she sits down every day thinking about, how do I muster the resources to get up and say, I want to go or leave?
Is it even that, or the fact that many times they're even concerned about the impact of that, mustering that courage to even do anything?
Exactly. And that was what I was going to talk about next. Even if they are financially empowered to do that, they start to think about all the sort of family and community gatekeepers, the social stigma, what will people say, societal expectation that shape, what a woman should be, where she should be, and how she should interact with society. So those are some of the things that actually just make women pull back and say, you know what, let me stay in my own shell.
So you see, there's that misunderstanding or clarity, so to speak, because some people say, no, women can be like men. So there's that thing where some people say, no, we need to pursue equity. It's not about equality, but equity. That understanding. So how can organizations prioritize gender equity as a driver rather than a challenge in itself, to gain that clarity for access to justice, to health, to a better life generally?
So before an organization can prioritize gender equity, there has to be that understanding of the business case for it. Many times when we talk about gender equity, people are thinking of, just put a few more women in the mix. No, there is a clear development and profitability, productivity imperative for gender equity. So with that understanding that you have a more productive workforce, a more innovative workforce, a more productive society, if you give women that chance, then you understand that it's not a tokenistic favor. It's actually enhancing your productivity. And if that is something that is understood, there are two things to do quickly. One is create the structural mechanisms to ensure that equity is not an afterthought, but is embedded in policies, in approaches to working, in representation. So if you're thinking about creating a committee or a team within an organization or a society, you know that having representation and active participation of women in decision-making spaces, we are enabling and catalyzing opportunities for socioeconomic development.
Okay, so as I let you go here, in very simple terms, how can we make the life of the woman in all of these things and the men in their lives a little bit easier in the simplest terms? Because sometimes we speak the grammar, but then to break it down, how do we go about it, even to the most educated?
To make the lives of women easier in the simplest terms, we need to understand that we cannot design for men and women using the same lens. So what are the unique features of a woman that makes it important, for example, within the healthcare system to program for her differently because she's coming into the system with different needs. What are the unique features of women going into politics, in academia? What are how are we thinking about some of those barriers, not imposed, not created by women, but as just part of either their physiology or their psychology? So things like caregiving, having to go for, you have to have a baby, you have to go for maternity leave.
Of course.
So it's just really understanding that we have to look at ourselves from a different lens to ensure that we're programming with equity in mind.
Thank you so much, Osasuyi Dirisu. Thank you for coming in this evening. We really do appreciate it.
You're welcome.
We wish you well.
Thank you so much.
Thank you.